Today I am going to share with you insulin used for the treatment of obesity or weight loss. Commonly insulin considered as a anabolic hormone, but these insulins used for the weight loss. These are liraglutide, brand name is Saxenda and Victoza. Next one, Semaglutide, brand names Wegovy and Ozempic. Next one, tirzepatide, Mounjaro. These are the images of the insulin used for the weight loss. These are the injectable prescription medicine used for the adult with excess weight, BMI greater than or equal to 27, and also who have weight related medical problems or obesity, BMI greater than or equal to 30. These injections used in children aged 12 to 17 years with body weight of above 60 kg. These injections help them lose weight and keep them weight off. First one is Saxenda. Saxenda contains liraglutide. It is a class of medications called incretin mimetic or GLP-1 agonist. Incretin are gut hormones that helps in digestion and blood glucose control. It's also including glucagon-like peptide 1, GLP-1. Its work by helping the pancreas to release the right amount of insulin when sugar levels are high. This insulin helps to move sugar from the blood into the other body tissues where it is used for the energy. Liraglutide injection also slow the emptying of the stomach and may decrease appetite and cause weight loss. Next one, difference between Saxenda and Victoza. Saxenda and Victoza are both injectable medications that contain liraglutide. They have same active ingredient, but they are approved for different uses. Saxenda is FDA approved for chronic weight loss management in people ages 12 and older. Victoza is approved to treat type 2 diabetes in people ages 10 and older. Saxenda and Victoza are both injected once a day. Should be used with reduced calorie diet and increased physical activity. Start with low dose that slowly increased over time. The starting dose of Saxenda 0.6 mg to 3 mg once per day. 3 mg is the maximum dose of Saxenda. Victoza starting dose from 0.6 mg to 1.8 mg once per day. 1.8 mg is the maximum dose of Victoza. Direction of Saxenda for weight loss. First week starting dose 0.6 mg. Second week 1.2 mg increased by 0.6 mg. Third week 1.8 mg increased by 0.6 mg. Fourth week 2.4 mg increased by 0.6 mg. Fifth week 3 mg increased by 0.6 mg. 3 mg is the maximum dose of Saxenda. Direction of Victoza for the treatment of type 2 diabetes. Victoza used for the treatment of type 2 diabetes, not for the obesity. Its dose depends upon the glycemic control of the patients. First week starting dose 0.6 mg. Depend upon the patient, dose may increase to 1.2 mg, and 1.8 milligram. 1.8 milligram is the maximum dose of Victoza for the diabetic patient. Next one is Wegovy. It is an injectable prescription medicine used with reduced calorie diet and increased physical activity to reduce the risk of major cardiovascular events such as death, heart attack, or stroke in adult with non-heart disease and with either obesity or overweight. Wegovy used in adult and children aged 12 years and older with obesity or overweight. It also used in persons who have weight-related medical problems. Wegovy contains semaglutide and should not be used with other semaglutide containing products or other GLP-1 receptor agonist medicines. It is not known it is safe and effective for the use in children under 12 years of age. Difference between Wegovy and Ozempic. Ozempic and Wegovy are the both injectable medications that contain semaglutide. They have the same active ingredient but they are approved for different uses. Ozempic not approved for weight loss, Wegovy approved for weight loss. Ozempic along with diet and exercise is proven to improve blood sugar in adult with type 2 diabetes. In adult with type 2 diabetes and non-heart disease, Ozempic reduces the risk of major cardiovascular events such as stroke, heart attack, death. It may help to lose some weight also. Direction for the use of Wegovy. Wegovy comes in 5 different dose strengths which are injectable under the skin. The starting dose is 0.25 milligram once a week and you will gradually increase your dose every 4 weeks. Your healthcare provider can select either 1.7 milligram or 2.4 milligram for your maintenance dose. Direction of Wegovy for weight loss. Its starting dose is 0.25 milligram. It is used up to first week to fourth week. Next fifth week to 8th week, it's increased by 0.25 milligram. The dose is 0.5 milligram. 9 week to 12th week, 1 mg is the dose. It is increased by 0.5 mg. 13th week to 16th week or longer, maybe it is the maintaining dose 1.7 milligram. It's depend upon the patient. Otherwise, it is increased to 2.4 milligram, depend upon the patient. Next one, Ozempic. Ozempic is taken once a week, exactly as prescribed by your healthcare provider, along with diet and exercise. It is used to lower blood sugar in adult with type 2 diabetes. Direction of Ozempic. Beginning dose is 0.25 milligram once a week for the first 4 weeks. This will help your body a chance to get used to the medicine. At the week of 5th, your healthcare provider will increase the dose 0.5 milligram once a week. Mounjaro. Mounjaro enhances weight loss with sustained treatment, but discontinuation leads to weight regain. It is the first and only GIP and GLP-1 receptor agonist approved for type 2 diabetes. GIP means gastric inhibitory polypeptide. Gastric inhibitory polypeptide. It stimulates insulin release. Mounjaro work by mimicking GLP-1 and GIP hormones that are naturally secreted by the intestine after meal which promotes insulin secretion. GIP means gastric inhibitory polypeptide. GLP-1 means glucagon-like peptide 1. It also reduces appetite by slowing down the food movement in the stomach. Most common side effect of weight loss injections: nausea, diarrhea, constipation, vomiting, injection site reaction, headache, tiredness, dizziness, stomach pain, change in enzyme like lipase in blood, hypoglycemia. Additional common side effects in children are fever and gastroenteritis. Serious side effect of weight loss injections. Serious side effect may happen in people who take weight loss injection. Possible thyroid tumors including cancer. Do not use Saxenda or any weight loss injection if you or any of your family have ever had MTC. MTC means medullary thyroid cancer. Don't use any weight loss injection if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2 MEN2. Before taking Saxenda or any of weight reduction injection, tell your healthcare provider about all of your medical conditions, including if you are taking certain medicines called GLP-1 receptor agonist like dulaglutide, liraglutide, albiglutide. If you have severe problems with your stomach, such as slowed emptying of your stomach, gastroparesis, or digestion problems. If you have or had problem with your pancreas, kidney, or liver. If you have or had depression or suicidal thoughts or mental health issues. You should inform your healthcare provider before taking these medications. You should discuss with your healthcare provider if you are breastfeeding or plan to breastfeed, because it is not known Saxenda pass through your breast milk. Next one, how to use Saxenda. All of these injections have almost similar procedure. Read the instruction for use that comes with Saxenda. Inject your dose of Saxenda under the skin subcutaneously in your stomach area, upper leg or upper arm as instructed by your healthcare provider. Do not inject into vein or muscle. Don't use the same site for each injection. Rotate your injection site within the area you choose. Serious side effect of Saxenda and other weight reduction injections: inflammation of the pancreas, gallbladder problems, increased risk of low blood sugar, hypoglycemia. Thank you for watching.